We thank you for joining us here today for this press event on this Thursday. To start things off today, Mayor Demings will announce and discuss a very recent major legal ruling. He will, of course, also share the latest information on COVID-19 testing numbers, CARES Act funding programs for small business, the Eviction diversion program, and much more. And he has some very special guests that are joining us today who have done some very special things here locally in Orange County. We're glad that they could be here. The mayor will tell you more about that in a moment. From the Florida Department of Health in Orange County, Dr. Raul Pino was here with insights and analysis of where we stand as we continue to battle the virus. And last but not least, our Comptroller Phil Diamond has joined us to share the latest details on tourist development tax collection. We start with Mayor Demings. Mayor?
All right. Good afternoon to all of you as we come to nearly the end of another week. I want to begin by briefing you on what I call some breaking news items. Circuit Judge Lisa Munyon has rejected a challenge to the constitutionality of our Orange County executive order requiring residents to wear face masks in public. The ruling means the mask mandate is legal. A mask help to slow the spread of the virus and save lives, and these types of lawsuits waste valuable time and resources for local governments. There's no recognized constitutional right to not wear a face covering. In other words, there's no constitutional right to expose others to a contagious and potentially lethal virus during a declared pandemic by not wearing a face mask. The safety, health, and welfare of all residents continue to be our number one priority here in Orange County. I'm pleased with the court's decision, and our low positivity rates today speak to the common sense of this ruling. You're going to hear more about the numbers from Dr. Pino and myself in just a few moments. I'm pleased with the positivity rates as we see them. For the last 2-week average, our rate is now 4.9%. Since the beginning of the pandemic, Orange County has had a total of 36,668 positive COVID-19 cases within our community. We had an increase of 174 cases from yesterday. We have now lost 386 residents to the coronavirus, and Dr. Pino will talk about the most recent deaths. That is an increase of 9 since Monday of this week. As we always say, our hearts go out to the families who have lost a loved one. Our Orange County Health Services free COVID-19 testing continues at the South Orange Youth Complex tomorrow from 8 a.m. to 1 p.m. And next week, the team is moving to the west side of Orange County in order to allow more people direct access to testing in the Winter Garden area. Beginning on Wednesday, September the 9th through Friday, September the 11th, the Health Services team will be at the George Bailey Park in Winter Garden from 8 a.m. to 1 p.m. Appointments are encouraged, but not necessary. All Orange County Health Services sites are also pedestrian-friendly, and residents 12 years old and up can be tested as long as there is a parent or guardian that accompanies them. And currently, the lab is getting back results now from the testing within 48 hours or less, so that's a fast turnaround compared to what we have been seeing here in our community. You can get more information about our testing at ocfl.net/COVID-19 and also make appointments. Just a few hours ago, the members of our Urban Search and Rescue Task Force 4 from here within Central Florida returned from their deployment in Louisiana. As you know, they were helping with the response and recovery efforts caused by the devastation from Hurricane Laura. The team was crucial in conducting primary and secondary search efforts in Louisiana with a focus on residential structures and critical infrastructure. Task Force 4 was made up of 42 firefighters led by the Orange County Fire Rescue Department, the Orlando Fire Rescue Department, and the Seminole County Fire Rescue Department. So join me in welcoming back those brave souls who were deployed into the Louisiana area. Talking a little bit now about evictions. Tomorrow, a federal order will go into effect, placing a temporary ban on residential evictions that will last until the end of this year. But I want to clarify some things here. This does not mean that tenants get a pass on paying rent. Many people see that as just a pass to not pay their rent. You're still obligated to make rent payments. The federal order that I referenced that came from the White House is being challenged in the courts, and so we'll have to see how that all plays out. The federal rent protection order is not automatic. Renters must submit a special document provided by the CDC, among other things, in order to qualify for the eviction diversion. That's really why it remains essential that both landlord and tenants apply to our COVID-19 eviction diversion program to receive assistance here within Orange County. And we have talked about that. Our information remains posted on our website regarding our eviction diversion program. So far, over 1,800 landlords and the same amount of tenants have submitted applications. The claims are being processed now. We have over $20 million in CARES Act money allocated to try and stem the tide of the looming evictions within our community. You can get information by calling 311 to talk to a human being, or you can go to our website at ocfl.net/eviction diversion. And as we talk about masks and stopping the spread of the virus, I want to recognize some students who have joined us from the University of Central Florida and Rollins College. The Mask On Students group is here. Since COVID-19 began, Orange County government has distributed more than 7.5 million face masks and more than 1 million bottles of hand sanitizers. Most recently, we donated 10,000 masks and 300 bottles of hand sanitizers to the new nonprofit created by this group of college students, Mask On. Their mission is to promote healthy habits and compassion around the Orange County area while supporting our schools here. To help Orange County Public Schools open safely, the group donated wellness kits which contain PPE, Clorox wipes, and other items to help children understand the importance of hygiene and social distancing. The kits were distributed at Columbia Elementary, East Lake Elementary, and Bonneville Elementary. If you're like me, we're proud of this group and our young people, and that is why we want to highlight them today. They epitomize how our young people come together during challenging times and find solutions to helping others. Members of the Mask On are here, and at this time, I'd like to have them stand and be recognized. Jiker Garces, Trami Din, Myrnie Khalil, Diana Lam, Ni Bui, On Bui, Angie Amato. Hopefully I did pretty good with your names. Okay, so thank you to this wonderful group of young ladies. Please give them a round of applause. Thank you very much. And we'll take a photograph right after us if that works for you all. Thank you for making a difference in our community every day. We are proud of them and will continue to support their efforts. And at this time, I'm going to turn it over to Dr. Raul Pino of the Orange County Health Department.
Good afternoon, everyone. Thanks for being here. Thank you, Mayor. As the Mayor indicated, we have 36,668 accumulated positive cases, and our recovery rate is 95%. We have tested 316,428 individuals in our county. And unfortunately, we've added 10 additional deaths since we reported last to you. So there are 10 in this group. And our condolences really with the families and friends of those who we lost. The age range is 69 to 96, 5 female, 5 male, 1 Asian, 4 black, 1 other, 3 white, 1 unknown, 5 Hispanics, 5 unknown. We also would like to offer you some information with regard to children infections. Accumulative up to September the 3rd, we have 2,465 individuals 18 and younger that has been diagnosed with the COVID-19 that we know about it. And we also have, in the last 14 days, 188 individuals. If I remember correctly, that number has declined just a little bit. With regard to the more detailed information that I normally would offer with regard to the schools, there was we, together with our legal department, determined that the information that was initially offered in more details is covered under state statute 64D 3036. So it is confidential information that the Surgeon General had determined that would be released to the schools so that they can help us a partner to make those determinations for quarantine and isolation. But because it's confidential information, I can't continue to release that data to the public in that format. We are looking for a better solution. We also spoke recently to the school board, and they are releasing the data twice a week. And that will, as far as I know, will continue to be the case. So be tuned for that information with more detailed data. But I can tell you the schools continue to perform well. We have not seen an increase of cases either in the schools or the parks. That seems to be areas that people are very interested. We have not been able to identify any outbreaks at the parks or any outbreaks at the school for that matter. In most cases, we are determining to be of community acquired, although we could see transmissions in the schools in the next few days, as if the disease progresses the way it is. But I'm actually pleasantly surprised that we have not seen more of that at this point. And I think the steps that the schools have taken and put into place are working. And this is a process that I want people to be conscious. It's a constant improvement of the processes that we have in place. And as we find things that need to be improved, we will do so. So we had a conversation with the board this morning, with the superintendent and some of her team members, and we are going to provide additional information to all parents. So we are working on it. They know the entire process, who gets quarantined, when the information gets released, who get isolated. So we heard some parents, some concerns yesterday with some level of anxiety because they were receiving letters, hey, a case I have been identified in your school. The people that were receiving the quarantine letter will receive it, but everyone else will not receive any notification. So they fell in a limbo. So we are going to plug that hole as well and try to work closer with the superintendents and the school to provide the most updated information. We have an excellent week last week. This week seems to be doing great. So far, we have accumulated in this week 425 cases. Last week, we have 798. So approximately by the end of the week, we are close to the 50% of what we saw last week. Unless we see something major over tomorrow and Saturday, I think that this week we continue to be a negative growth. For our positivity rate, 14 days average rolling positivity rate, that does not include the testing that is done at Disney in the bubble. Our positivity rate for the 14 days, it is 6.45. Our positive rate, again, rolling average, not including the bubble, only county residents, 6.45, and that came down from a 20.2 that we had at some point. So the county is in great shape. It's a holiday weekend coming. Please do not make the mistakes that we all make on Memorial Day weekend. Wear your mask, wash your distance, wash your hands, and we will continue to decrease these and put it under control. Thank you very much. I will pass the microphone to Controller Diamond.
Thank you, Dr. Pino, and good afternoon, everybody. I would like to provide you with updated tourist development tax information for the month of July. And Orange County collected $5,158,000 in the month of July. That is a 77% decrease from July of last year. In dollar terms, that's about a $17.5 million drop from last July. TDT collections obviously increased compared to our June collections last month. And even though there was an increase, though, that our collections still remain at historic low levels. We believe that the increase is attributable in large part to Disney World's July opening, even though it was a limited opening. And looking forward to August, there are many positive developments to look at. First of all, as Dr. Pino has explained, not just today, but before, there's been a significant decrease in our positivity rates and the number of new statewide and Central Florida COVID cases. Also, due to the safety measures adopted by the county, including the mask ordinance, and measures adopted by the tourism industry, there have been no reported outbreaks of the virus at the theme parks. And over the long term, we believe that a solid safety record will only enhance traveler confidence and help to accelerate the recovery of our tourism economy. That said, these positive developments have to be put into context that the worldwide pandemic continues to weigh heavily on the tourism industry, and the unemployment rate in this area reflects that. We'd also note that Disney World is reducing park hours and delaying the opening of hotels. Universal has also closed and delayed the reopening of hotels and delayed the construction of its planned Epic Universal theme park. On the expenditure side, the county continues to use TDT reserves over the short term to offset the TDT collection shortfall. As you will see in the TDT cash reserve summary that we have included with our press release this month, reserves decreased by about $21.7 million last month. And while reserves are still at a healthy level, it's important to minimize the drawdown given the uncertainty of when the tourism industry will recover. That said, the mayor's recent decision to suspend or cancel all contracts connected to the convention center expansion projects will help reduce future TDT expenses, and we support that decision. I'll be happy to take any questions, and if there are no questions, I will wish everybody a happy Labor Day.
Okay, I know that we have some Spanish-speaking media here as well today, so as we move forward, if you want to ask any questions in Spanish, I'll ask Ms. Ilia Torres to come forward and she can assist myself and perhaps Mr. Diamond if the response is required in Spanish. Dr. Pino, if it's in Spanish, he is fluent and he'll be able to adapt. So with that, we'll open it up for questions.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, can you explain why the state is now considering this information that you all have been giving about the schools confidential when it doesn't identify any names? It just identifies student versus teacher at a school where there's a lot of kids and such. And then does that also impact what you had mentioned last week or Monday, I guess, about the possible secondary transmission, could you give us an update on that?
With regard to the first question, this is the first time that I'm going to tell you first question first. The information that I was releasing prior is labeled confidential under those statutes. So I take responsibility for releasing that information, although there were not particular information about individuals, as you said. So we also have put a request to get further clarification on the statute. I'm new to Florida, so the statutes are a little bit different. We hope that that is the case. But again, the Board of Education release information twice a week. That is going to continue, and they are able to release the information that they considered to be pertinent. With regard to the student and the teacher, it was, and again, this is confidential information, I guess, right now. So I will not be able to release that information as yet. But with regard to cases like that, I'm going to explain in general what is happening. So when you have community distribution, and the school just started the first week, and this is for any case, and then you see a couple of cases happening in the same space, meaning the same school, the same classroom, or the same environment. But they happen right there in day 6, day 5, day 7, and you have community transmission. It's very difficult to determine if it happens in the community or happening in the school, especially with the schools are really, really enforcing the mask mandate, and there's a lot of compliance on that. So that by itself reduces the possibility of transmission. Now, what is helping us a lot, and this is an ask to everyone that has the teachers and the principals and the superintendent and everyone knows, it really helps us to have a seating chart of the classroom. And it really helps us to know that every child sit in the same place every day of the class, every day, if that's possible. Because the moving around will generate issues, especially when you have to determine who was too close to who. And I explained to you in the past that our rule is that we take 6 feet front, sides, back, and diagonal. And in those cases, we normally will have, if we have the sitting chart, we will normally have 6 to 8 individuals to put out in quarantine. And that will help the rest of the classroom to continue with normal. Another thing that will help us a lot is to cohort lunch and cafeteria use. Because it's kind of loose time where they are less structured. But some schools are doing a wonderful job sitting 2 students per table, facing all in the same direction. I mean, the schools have really, really tried to put in place protective measures that are giving results. We may have to increase some areas, we may have to do some different things, we may have to change some communication, but we are extremely happy of how the schools have taken those into consideration. Thank you.
Don't walk away, Dr. Peanut. This is Eric Mock with Spectrum News 13. I have a feeling you're going to be up there for a while right now. So I know you said you can't talk a lot about the children, but with 188 children, you said in the last 14 days, how many quarantine letters have been sent out to people who, I know we had heard from the district that 199 quarantine letters have been sent out a couple days ago. So how many at this point have been sent out to parents and families?
The school district is right there, so.
Sure, Eric. So yes, 199 as of Tuesday. We had 21 additional letters that have been issued since we reported on Tuesday, for a total of 220. And that's 12 schools total.
And are you able to say how many of those are, of the cases in the schools, how many are staff versus students?
So, yeah, let me see. Jotted down a couple of notes. 198 students, 22 staff.
Now, just I would like to clarify something. the numbers of individuals in quarantine should not be used as a gauge to measure the pandemic. Because quarantine is a very, very preventive effort. And we have been very, very aggressive, surgical, but aggressive. So there are some times that we take extra steps by placing additional individuals in quarantine because we are iffy about transmission. We are not 100% sure. We didn't get all the information, or we may have conflicting information. And we are running on the cautious side of things so that we prevent any transmission from happening in the schools. And the principals and the board has been very helpful in that. But I want to give you that insight, now because that number is not really a reflection of any dimension of the pandemics in the school, but more a reflection of how aggressive we and the board has been on quarantining anyone that we suspect that at any point may have had any contact with someone who was positive.
This is Steve Hudak from the Sentinel. This is for Dr. Pino and Scott. So there are a lot of parents out there who obviously are concerned about sending their kids to the brick and mortar schools to learn. And with less information now, how can you guys allow parents to have more confidence in that process of letting the kids go there, having them learn, and not being, well, frankly, freaked out about all of it?
So the first part, Scott can take a shot at it, when the parents that need to receive information are receiving the information. So first, the principals are setting an alert. Hey, in your school, someone was diagnosed positive. Your child may be placed in quarantine. Be on the lookout for a letter from the health department. That's kind of, in general terms, the first communication that parents receive. Then another communication goes to the parents that are affected by the quarantine, meaning, hey, your child has been placed in quarantine from this day to this day. They can return to school this day. And then what we found the loop, and people were freaking out, the expression that you use, and I communicated yesterday with some parents through emails, is that they didn't receive a second letter saying, hey, your child does not need to quarantine. Everyone that is in quarantine has been placed already in quarantine. And that vacuum there of information was creating those feelings of anxiety and not knowing what to do. But again, we talked to the board today, hey, we found this out last night. We better do this way, and we are working on it since this morning. But Scott?
So Dr. Pino said it well as far as our process. When we're notified of what we consider a documented positive case, which is different than a lab confirmed case, we're getting documentation of a case. We're notifying, sending out a general notification to the parents at the school that somebody at the school had a positive case. At that point, whoever's impacted by that individual with the positive case, they'll be notified specifically that there'll be a follow-up from the Department of Health with quarantine if necessary and given direction. So we're narrowing it down to that group and notifying them. And that happens as soon as we know through the principal. At that point, once they're issued the letters, the quarantine letters, as Dr. Pino said, our principals are provided those letters through the Department of Health. They'll give the letters directly to the parents. They'll call them and tell them, or the employees. And then in order to close the loop, as we talked about, we're going to follow up and say all of the quarantine letters have been distributed. And if you didn't receive one or didn't receive a call, then you can return to school. You would not be under the quarantine. Just to close the loop, because there was, as a result of the initial communication, there was a lot of parents, I think, out there that were saying, well, am I going to get a letter? Am I not going to get a letter? Was it my child's teacher? Was it a student? And we can't disclose, because of confidentiality, who it is, but we're at least letting them know whether they were impacted or not, and then they're going to get a quarantine letter. So that's part of it. The other piece is, and we've said this from the beginning, we're going to report numbers of positive documented cases on Tuesdays and Fridays. We started that Tuesday a week ago. We reported again this past Tuesday of 54 positive cases. That was students and staff. And then we'll report again on Friday. Because positive cases aren't as clear-cut as quarantine letters, we're giving time to be able to gather those and then send those out. We've been sending them directly to the parents. We through our Connect Orange messaging, which could be voice, it could be text, it could be email. We're also communicating that on social media. We're trying to be as transparent as possible. The other thing we're going to do is we're going to work on putting a web platform together to be able to have those numbers updated regularly, whether that's daily or still twice a week. We're going to have them out there so we can refer folks directly to our website. And we're working on building that out right now, trying to streamline the form process and the reporting process, because I'll tell you, we're tracking everything. We're tracking symptoms. We're making sure that we're monitoring that. We have case management. In fact, our handbook, we're getting ready to release our version 6.0 of our handbook. And that includes all of our case management process. So we're doing everything we can to make sure that we're refining the process. This is part of our continuous improvement. No one's been here before. No one in this room has been in a pandemic before. Right? So we're all going through this. And as we move through it, we're going to refine that process. But we're going to remain transparent. We're going to make sure that we're protecting confidentiality. We do not want to disclose an employee or a student who has tested positive. We want to make sure we're protecting that. And we're still protecting the health and safety of all of our students and all of our staff. And our teachers are doing an amazing job. As Dr. Pino said, they've just done a wonderful job of doing what they've done so far. This is the 19th day of instruction. It's the 10th day of face-to-face. And so throughout that time, we've done pretty well, I think. And I appreciate Dr. Pino and discussing with Dr. Jenkins and her team today. And I think we're going to continue to refine. We're going to continue to get better. We're going to maintain that transparency and keep moving forward. So thank you.
And if I can add, Scott, also this protocol is going to be placed on the web. I mean, who called who, when it happens, what could happen. So the parents have all the information that they need. Because it is confusing for us at times. So imagine someone that has a child in the school, or 3 kids, and then distant learning or driving. So we are going to place the protocol, we tend to call these algorithms, online so that people can see it, watch it, and determine where they are at.
That's going to be the Department of Health's protocol. We're going to put it on our site too and include it in what we do as far as our manual. So that.
George with West 2 News. I have a question, same for the both of you guys. Was it the school district that then went and said that they didn't want the health department to be releasing this? Because I know you said you spoke with Dr. Jenkins earlier today and the district. Was it them that said that they wanted to be the ones to release it? And then before you answered that, what's the difference between the school board releasing this information and the school district? Are you guys releasing not as much information in a different way, or how is that any different than what we were getting here?
For that second question, I will refer to a lawyer. The last part of your question, so I don't know what the difference is. There may be some legal nuances on the law that I don't know, so I'm not going to comment into that. With regard to the first question, what happened is that I released that information without previously consulting more in details about what my authority was to release that information on that. So the responsibility is mine.
Dr. Pino, Deanna Albritton from Channel 9. As more people, or as we're working to increase consumer confidence to get people here, a lot of people are looking at the positivity rate and noticing that what we present here or in the state of Florida, throughout the state of Florida, is different than what pretty much every other state is using to determine travel advisories or to calculate the percent positivity rate. So how do you reconcile those things? What advice do you give to people about what information they should be looking at if Florida is calculating this in a way different from nearly everyone else?
So with any epi information, any data, there are many ways to get to the same equation. with the positivity rate or death rate or even the recovery rate, let me give you as an example of the recovery rate. It depends on the individual. And in this case, maybe a team and what the preferences are. I don't think that is calculated intentionally in a different way or with the intention to elevate it or decrease the rate, because the state has also given us the ability to calculate our own rate without any interference. So there are different ways things are to be calculated. I will have to look at the formula, meaning how that data was calculated in other states, to be able to make that opinion like, okay, I like this way better, I like this other way better. But it's basically what you include and what you exclude and in the positivity rate. For example, I think that it is not used for us in continuing to track the positivity rate for the entire pandemic. But that's my opinion, my personal opinion as an epidemiologist, because I don't think that people that were infected 3 months ago will make any difference for me as a health officer trying to prevent any pandemic. They already probably recover everyone, and then let's move on. But the state decided, the team decided that it's also important to calculate what percentage of the population has been positive during the pandemic. So it's a matter, I think, of preference in many cases. But if you give me the formula of this state calculated this way and Florida is calculating this way, because even across our data, things are calculated in different ways, but behind that data is always a data script. That means how those numbers are calculated. So we will have to look at that to be able to arrive to say, okay, this was calculated this way or that way. So if you give me a reference to which number and which state, we'll be able to look at it and give you a better opinion.
Hi, it's Samantha Sosa from Fox 35. My question's for Mr. Diamond. So I know July's collections were better than June, but was it where you hoped or expected it would be? And what's your reaction to those numbers? Where's a level where you'd be comfortable with, a percent down from the last year that you would be comfortable with, that you feel would get us out of this circumstance of having to use our reserves?
Well, it was about $5 million in July, and that's about twice what we collected in June, which ordinarily you'd say, wow, twice as much, that's really good. And I guess it is really good, but it's also far less than what we budgeted. It's far less than what we need to pay our bills every month, honestly. If we're going to be collecting $5 million a month, that's probably about enough to pay our mortgage, and that's about it with TDT. The rest would need to come out of reserves. Just by example, we used about $21 million out of reserves this past month. So if you add that plus the $5 million that we collected, that would tell you about $26 million. I can tell you that the average that is spent every month is somewhere north of $20 million, typically. So I think you'd want to get at least to that point to be comfortable. And personally, I'd like to get to the point where not only are we not using reserves, but we are replenishing reserves. So that's what I'd like to see. And as far as when we see that, I don't know that anybody knows.
Eric Sandoval with News 6. I guess, Mr. Diamond, for you and Dr. Pino, I actually have the same question, just a variation on it. Economically, what are your hopes and your fears going into Labor Day weekend, which is, usually the last hurrah of summer typically? Dr. Pino, the same question. What are your hopes and fears going into the weekend?
So, Eric, I thought you were going to be asking me for medical advice, and I was going to say I stayed at a Holiday Inn, but or however that goes. I think that good health is good for the economy, and it's something that when people think about where they want to go and take a vacation, they're going to want to go to some place where they feel safe. And and I think from an economic standpoint, that's really important, that we maintain our health and we do everything we can to get to get all those numbers down that Dr. Pino reports on. From the standpoint of someone who lives in the community, who has family and friends and coworkers and everybody else that you know, you just want everybody to be safe and healthy, and you don't want people to be getting sick. So, that's what I'm really hoping for, and hopefully people will be safe over the holiday. I mean, it's a day people get out, they go to the beach, they might go out for a picnic or something. I just want people to be safe. That's really it.
So my fear is that we may have not learned from Memorial Day weekend. My hope is that we learn from Memorial Day weekend. And what we need to learn is that we can do everything that we have normally done with some limitations with regard to number of people, distancing, wearing masks, and washing our hands, but the life of others are worth for us to take that little inconvenience, to have a mask, to wash our hands frequently, to keep our distance. We can go to the beach, we can have a barbecue, we can have friends over, as long as we keep those measures in place, and we know they work because they have worked here. And we have reduced infection rates very, very close to what the World Health Organization has called, that is the 5% where you consider to have the pandemic under control in your area. And we have maintained that by the support and the courage of our community to take into this. The parks are open, and we have not seen our infection rates increasing. The schools have opened, and we have not seen a rate increasing yet on those two areas where there is a lot of social activity. If we want to continue this way, we have to wash those 3 W's. Wash, wear your mask, wash your face, wash your distance, and we will be fine.
Buenas tardes, Félix Pirela de Telemundo por acá, el doctor Raúl Pino. Doctor, mi pregunta tiene que ver con lo último que está mencionando, en la última respuesta que acaba de dar, y es que estamos en un escenario similar, como usted lo decía, de lo que estábamos en mayo. Estamos en un momento donde las cifras de alguna manera son alentadoras de lo que vivíamos a principios de mayo, pero llegamos nuevamente al Memorial Day Weekend, y de ahí en adelante se dispararon los casos y nos costó 3 meses llegar a donde estamos nuevamente para poder bajar nuevamente los casos. Sus recomendaciones, porque estamos en este fin de semana feriado, y también me gustaría aprovechar la ocasión que diera la versión en español de la respuesta que dio con el tema de esta recomendación legal que le dieron al Departamento de Salud para de alguna manera guardar los casos de positivos que se presentan en las escuelas por un tema de confidencialidad.
So the question was to repeat what I said with regard to, the confidentiality of the data. And the other part of the question was to talk about the importance of the Memorial Day weekend and keeping these, observing the CDC guidances. So, con respecto a lo de las escuelas, la información de las escuelas, yo erróneamente di demasiada información con respecto a los casos. El Departamento de Salud tiene limitaciones legales en qué tipo de información puede proveer que otras personas, otros departamentos no tienen. Porque nosotros recibimos esa data de los servicios clínicos que se le ofrecen a las personas, y entonces la información está protegida por HIPAA. Nos proveyeron la información de que, basado en las leyes de la Florida, esa información que nosotros proveemos al sistema escolar con el número de casos positivos, en qué escuelas están y cuáles son las direcciones de esas escuelas, es información protegida. Yo no voy a poder dar esa información, pero las escuelas pueden dar la información, y la información las escuelas las van a continuar dando 2 veces por semana. Con respecto a Memorial Day Weekend, Labor Day Weekend, nosotros tuvimos en Memorial Day Weekend, la gente, estábamos en una posición muy buena, nos pusimos a fiestar, a gozar, nos acercamos demasiado, nos fuimos a tomar a los bares, y entonces nos pasó el aumento en el número de casos. Con el esfuerzo de la comunidad hemos llegado a este momento en que estamos en muy buena posición, pero estamos en otro fin de semana feriado. Queremos que la gente aprenda que se puede gozar, se puede pasar bien y se puede disfrutar al mismo tiempo que mantenemos la distancia social, que nos ponemos las máscaras y nos lavamos las manos. No hay una contradicción, la podemos pasar bien, estamos juntos, mira cuánta gente hay en esta habitación. Y estamos todos juntos, estamos todos protegidos, estamos manteniendo distancia.
This next question was texted in for Dr. Pino from Nikki Zizaza. Dr. Pino, specifically, what information in reference to school data can you no longer or can you not release?
Detailed information. Oh, you're always over there. Yeah.
Okay.
That's it?
That's all I got.
All right.
Okay, if there are no additional questions, let me just say thank you to all of you for being here. As we approach our Labor Day weekend, do remember that overall, Orange County remains a safe place to come and to visit. And so we just have to make certain that we're doing all of those things that Dr. Pino and others have said that we have to do to keep ourselves safe. And one of the number one things is to wear our masks. So thank you all for being here.